All right, good morning. Thank you, everybody. This is the fourth webinar put on by the First Nations Public Service Secretariat since the onset of the COVID-19 pandemic. My name is Selena Dorme. I am the engagement coordinator for the FNPSS, as well as proud member of the Tsleil-Waututh Nation here in North Vancouver. As I mentioned, this is the fourth one. We've held 3 just previously within the last 7 days, and they've been very successful. We received a tremendous amount of positive feedback from both community members that are viewing and the First Nations that have been speaking. So we will continue to do this. So stay tuned for another one, another announcement for another webinar next week. A lot of the questions actually received for the previous webinars were pretty specific to Indigenous Services Canada and specific reports that are supports that are available to BC First Nations. So today we actually have Bill Guerin, the Associate Regional Director General for ISC BC Region, joined by Leah George-Wilson, the co-chair of the First Nations Summit and Chief of Tsleil-Waututh Nation. So thank you both for joining. We're going to go ahead and get started with Leah. Both speakers are going to speak for just a few minutes, and then we'll move on to the Q&A. So take it away, Leah.
Thank you, Selena, and good morning, Bill. ACMNACIA, I, Tinishqualowin, quick snalast, Anthisitia ama, Thumana, Quetzenthalia, Slahotziam, Meetsap, Quitwilum, Tinatamoch, Tinahwamoch. Greetings to our honored guests and my dear ones. I have good feelings in my heart to see all of you today in our language that we share, our Hunkaminam speaking peoples, Musqueam and Tsleil-Waututh. I said my name, I said who my parents are, because it's important for you to know that I know exactly who I am. And I welcomed you to the territory of the Huelmuch people, Tsleil-Waututh, Homathquiam, Skahomashod. So Tsleil-Waututh, Musqueam, and Squamish, thanking all of you for joining us today. Also thanking FNPSS and Bill for having me on the panel today. Happy to be here. I just would like to say that my community is in North Vancouver. The background that you see here is Burrard Inlet. That's Ironworkers Memorial behind us. This is exactly where I'm currently situated. So we're just outside of the city, and which is very different than a remote community, although we have the same kind of challenges that communities that live further away from the cities have. And well, that includes never having enough human resources or financial resources. And in these kinds of emergency situations, our community really pulls together. We have on our website, we've put up a couple of video links, a message from the chief, a message from a youth trying to give reassurance to the community and let people know where they can reach out for services. We also have various Facebook pages and newsletter that goes out to every house in the community. We probably have, I don't know, 100 or so dwellings in the community, including a couple of apartment complexes. So everyone's getting the same kind of information. People are connected through Facebook chatter groups. So we're really trying to do a lot to support the community. We have available counseling resources via telephone. We have a pandemic response plan that's being implemented. Currently, we're running only essential services through our administration office, and essential services basically is health, some community development like social assistance, access to counseling, and financial services. We also have some administrative support in the office, just trying to make sure that we give people the kind of support they want and that nobody feels like once the office, what people traditionally call the band office, we're just calling it administration. People don't have the feelings of abandonment. If the office closes, there's always going to be a way to access our leadership and our administration leadership. I think these are such, and you've heard it before, these are such unprecedented times that in some cases we're just going along with what's happening and doing what we're able to do within our community. Of course, looking to receive support from Indigenous Services Canada as well as First Nations Health Authority. I think that's it for me. Over to you, Bill.
Thanks, Leah. Good morning, everybody. As Selena mentioned, I'm Bill Guerin, Associate Regional Director General for Indigenous Services Canada in the BC region. I'd like to acknowledge as well that we're streaming this morning from the unceded traditional territories of the Squamish, Tsleil-Waututh, and Musqueam people. Also important to acknowledge that as an individual from Musqueam Indian Band. I was asked to talk a bit about what the government's doing, and we'll try and focus most of the time on questions and answers, I think. But I would like to point out that our department, the entire government of Canada, is working collaboratively in our province with the First Nations Health Authority, with organizations like Emergency Management British Columbia, with the Leadership Council, on a number of different levels. What we're trying to achieve is a situation where no door is the wrong door if you're looking for support. It doesn't matter who you go to, your requests and your concerns, your issues will be appropriately triaged, you'll get responses, and that you'll have access to the programs and services that you need. As a department, we've implemented a number of measures recently, whether primarily in the administrative area is what I'll focus on, given the focus on administration here. But things like eliminating or just temporarily suspending reporting requirements so that they're not an obstacle. Allowing the time and effort of people in the band office to focus on what the urgent priorities are. And that's really taking care of the essential needs of the citizens in your community. You know, it's certainly not a time for business as usual in our department, and we're trying to push ahead and make the changes that we're hearing are needed to free up the time. So certainly if there's suggestions on other things that you know, participants think we could and should be doing, we'd be happy to hear those as well. We've also heard some concern about in this era of uncertainty and band offices being scoped down to provide essential services, physical distancing. Our band's expected to lay off staff, and that's certainly not a direction that's coming from the department. I know as a department, we're certainly embracing telework. We've got all of our staff teleworking now. We've got a couple of essential people in the office, but virtually everybody's doing the best they can in a telework arrangement. With respect to funding, allocations have already been sent out to First Nations for emergency management and social program supports. Our region had $7 million in emergency management and $2.7 million in social. The money that was put out in amendments, they went out last weekend, and funding officers have been following up with individual First Nations to get the amendments back. It's important to note that those are initial allocations. Those are in no way, shape, or form full or final allocations. What the intent was to get money out the door into the hands of First Nations so that if you needed cash, you had cash to do stuff right away. There's a lot of things that'll need to be sorted out on the back end with respect to reporting. But the important thing is to make sure that you've got the resources that you need right now to be able to conduct the business that you need to do. When we're talking about emergency management, it's for things like emergency operations center costs, incremental costs related to shipping of food and other necessities, costs related to the continuation of essential services. There's some flexibility for social and cultural supports as well. So it's things of of that nature. On the social side, it's again, I'm just looking at some notes here. It's things like buying and preparing, delivering food to elders, hot lunch programs. It's allocations to individuals through the social programs. And we're looking to mirror what the provincial government's doing on their side to maintain an equal playing field on and off reserve. A lot of our changes that we've implemented so far relate to support to band operations. It's things like the utilization of electronic signatures to facilitate the rapid processing of amendments without the necessity of having to get a council together in one room to sign a document. Again, so it's to ensure that you have options for physical distancing and to support the simplification of the delivery of services. As I mentioned earlier, deadlines have been extended. There won't be any funding halts for non-submission of reports. We're temporarily suspending all recoveries and funding halts, as I say. Certainly, if anybody's experiencing cash flow difficulties, we'd want to hear about that. So you should contact your funding service officers so the changes can be made in that area. Likewise, as well, if you're not aware, if you've received a funding agreement amendment with respect to the emergency management or income assistance funding, please let us know. Please, whether it's through this chat or whether it's back through your funding service officer, and we'll make sure that the amendments get out. What else can I tell you? Funding. I think everybody's probably heard that the $305 million was passed for the Indigenous Community Support Fund 2 days ago on March 27th. $215 million is the allocation for First Nations. We understand that a formula will be created, the money will be distributed out to the regions, and then we'll in turn move the money out to First Nations. We have not been provided information on what that formula is. However, we do expect it very shortly. And as soon as we do get information, we'll move that information out to First Nations as well. With respect to the rest of the money, there's $15 million going towards supporting regional, urban, and Indigenous organizations for members living away from communities, the off-reserve folks. There's another $45 million for Inuit people that will be going through Inuit organizations. And I think I'll probably leave it at that for now in the interest of time, just so we can allow as many questions to come in as possible. Thank you very much.
Thank you both so much, Bill and Leah. We're going to go ahead and get on to our first question. This first question is in regard to the emergency disaster supplement for existing MSDPR clients. For example, if a client has already accessed $40 in crisis food, they will be issued another $40, or if clients are in self-isolation or quarantine, supplemented up to $100. The question is, will Indigenous Services Canada match these benefits for on-reserve income assistance recipients?
My understanding is that we are mirroring the province. So if the province is doing that, my understanding is that we would also do that. But that is a very detailed, specific question. I will have to have our band social development program weighed in on that following the call. So if we know who that question came in from, we'll certainly get back to that community and we'll get information out to all communities.
Great, thank you. The next question is there a summarized list of federal supports available for off-reserve members? If so, please share.
I am not aware of a comprehensive list. I know there's a number of organizations working on lists. Certainly our department's working on one that we would like to get up on the First Nation Public Service Secretariat website. where the BCAFN's also trying to create a list of resources. I saw one come across my my computer last night. So what we hope to do is certainly get as much information up as quickly as possible on the multitude of different supports from other government departments and the provincial government as well. And even if it's not us preparing it, to find a host like the First Nation Public Service Secretariat that could aggregate the information and have it all in one location to try and simplify the process for First Nations.
Thank you. The next question is, are there any templates available for Band Office continuity plan during COVID-19?
Not that I have seen. I guess some additional detail on what sort of information a band would be looking for. Is it on the level of a business continuity plan and how a First Nation would continue operations, or is it something more detailed or different? I think would be helpful to be able to answer that.
Yeah, we can definitely ask. Oh, go ahead, Leah.
Maybe it's part of this. One of the things that our social worker or social services department wants to know is, with the additional people applying for social assistance, increases the workload, and we're working remotely as much as possible. We probably will need to, in these times, hire someone to help put the paper through. Is that something that it would be included in this, in the allocation we've already received, or could be reimbursed on the end?
Thanks, Leah. Two things. With respect to the earlier question, I would also point out that the First Nation Health Authority has resources for pandemic planning. So that's something that will also need to be factored in when you're looking at continuity planning in a band office. With regard to the resources in a band office, we have implemented, and this is a two-part answer, we have implemented some streamlining measures with respect to application process, just to ensure that income assistance recipients are able to maintain some physical distancing from the people processing the applications, to try and create a situation where everybody's health and safety can be respected. We do expect there to be caseload increases throughout the province, and I would be surprised if it wasn't throughout the country. Certainly the province will be experiencing it as well. I haven't heard anybody ask the question about additional resources required in a band office to process that, and I'll certainly take the question back. But at this point in time, I haven't heard that there will be additional resources available, and I'll have to check and see what resources might be applied towards that.
Great, thank you. Next question, is the social funding being allocated going to be used to support urban members or only members living within a First Nation community? The next question is kind of similar. What supports are in place for off-reserve folks, and where do you find these?
We haven't received a lot of information with regard to supports for off-reserve individuals. Just looking for some of my notes. Through the money that was recently announced, that would be going to organizations like friendship centers, is my understanding, and that towards some of the supports. It's a bit of a gray area at this point in time as to how far a First Nation would be able to extend government resources that are primarily targeted towards on-reserve program service delivery off reserve. So that's certainly, if that's, I would suspect that's an overarching question that the vast majority of First Nations have. So we'll look at that. Somebody's trying to message me that well, I've done something to my computer here, But the First Nations will be able to use some of their allocations, but I can't tell which allocations. I would assume it would probably be under the emergency management stream.
Leah, anything you'd like to add to that as far as supports for off-reserve members that you have done so far?
All we have done is put the links on our website and to our Facebook pages and out to the community, all of the areas that are available to all members off reserve to reach out for support. There hasn't been anything that we've been able to do on reserve or from the administration side, except for things that we're already doing for all of our members. Like we have a health and wellness grant that goes to all members, so that's come out early to support people, and that's just a bit of money. And we haven't, with the limitations to the program resources that we receive on reserve needing to be spent on reserve, we don't have anything available for off reserve. Although on the food security side, we're currently doing an inventory of all fish and wild meat stock inventory that we have to see what we can distribute. Thank you.
Thank you. Next question is, the initial allocation that was sent, was that both emergency management and social assistance in one payment?
Should have been two different service codes, lines of coding, but it was one amendment. So two individual amounts on one amendment to each First Nation.
Thank you. This question is for Bill. As an off-reserve member, will there be financial assistance available if I lose my job?
I think it's important to remember that there are other benefits besides just Indigenous Services Canada. So things like employment insurance would be one option. There's the other $500 a week that was announced for self-employed people, and I presume people that aren't eligible for unemployment insurance. Provincially, there's a renter's benefit now as well. So I think what we need to do is work collaboratively to try and get as much information on the different types of supports that are available for people in one location. Unfortunately, it's a situation where individuals are going to have to apply to likely a number of different sources to access all the benefits available to them. But there are some benefits available if you're EI or even not EI eligible off reserve, and I presume on reserve as well.
Mm-hmm. Thank you. Next question is, what is the best contact to submit resource requests to Indigenous Services Canada or to the First Nations Health Authority?
We've each got a dedicated COVID email line. Our email line, it's not a line, it's a mailbox. Sorry, mixing up my my language here. We've also got a one window approach, and we triage as they come in. So whether you submit it to ISC or whether you submit it to FNHA or EMBC, whatever organization receives it will take a quick look at it, do what they can do on their side, and then move it off to the other two partners so that we can concurrently look at it as well. Certainly we can get the information on our email address has gone out numerous times, but we'll make sure it's also available following this on the First Nation Public Service Secretariat site.
Great, thank you.
I'm assuming we can do that, Selena.
Yeah, yes, we can. We're happy to share any information on our new website, which just launched a few days ago. So we're really happy to share that. There were a couple of questions that actually came directly to our email. So I'm going to go ahead and ask those right now. It's in regard to a communication strategy. Can it be developed a better one. A lot of people are self-isolating and social distancing, which is good, but can we develop a more clear statement on what flattening the curve means, so the point that we don't overwhelm our medical system and social distancing? Again, we understand that that's going to help, but communities, in small communities, we don't have those services and will be brought to larger hospitals. So we really need to communicate more on what flattening the curve means, specifically for those remote communities.
Yeah, that's a good question. My understanding is the First Nation Health Authority is working on communications on that. So we'll certainly follow up with them and see what can be shared with all First Nations across the province.
Thank you. Next question is, again, comes back to off-reserve. We're concerned off-reserve members are not able to get access through regional organizations. We feel better equipped to get funding directly to members. Why can't the funding come directly to the band for all members?
Yeah, the way it's structured right now is the funding's not coming out directly to the bands. It certainly will take note of the question. It's not one that I can answer right this second, but we will take note of it and feed that back in and look to get a response back out. There are a number of questions with regard to accesses for off-reserve members. Some of the new funding that we have, I understand, can be used for off-reserve members, but I'm not clear on what the parameters are as to how far any individual First Nation can go, what would be an eligible expenditure, what wouldn't be. So that's information that we've got to provide. And as soon as we get additional clarification, we will provide that out to all First Nations.
Great, thank you. The next question is, on the website, you mentioned that funds will automatically flow to communities. This has happened for the initial allocation. Will those payments continue, or will the nation have to reapply?
For the next tranche of funding, we haven't been given direction, but I would assume that we would move it out the same way we've done the other money, is just as an allocation out to First Nations with a simplified amendment process. And then we haven't been advised as to what a process might be to try and access additional funding yet beyond the initial allocations. But you know, for income assistance, people should call our band social development worker line, ask specific questions there. They can let any additional resource requirements be known. And they, for any program area, emergency management, the new community support fund or income assistance or regular programming, contact your funding service officer or send an email to our COVID email box. I would point out as well that we're striving for a 48-hour maximum return response time on our COVID email box. So if there are people that have asked questions that don't have an answer within that time frame, please let us know as well so that we can follow up on that.
Thank you. Next question, does the EM and IA support funding have to be spent this fiscal year, or can we carry it forward to April if we don't have time to roll out in March?
We're looking at implementing flexibility across a number of programs that would allow for the retention of money across the end of the fiscal year. So I am going to assume that these monies can be carried over across the fiscal year. I haven't seen anything definitively stating that at this point, but that is my assumption.
Thank you. Next question, is there any for new support from Indigenous Services Canada for finance, administration, audit related challenges?
I don't think anybody's contemplated that far down the road, but we'll certainly put that in the basket of issues for consideration when we're looking at additional funding down the road. Yeah, Large-scale events like this certainly do put an additional pressure on administration, bookkeeping, finance services, and at the end of the day, that will trickle over into audit as well. So thanks for the question, whoever it was, and we'll make a note of that for follow-up.
Sure thing. Thank you. Next question is, some of our communities are remote and isolated, and our health teams are smaller than others across the province. Are there supports to aid the healthcare streams for training to support our health team leads if our communities see that COVID-19 has hit their community?
Yeah, that question's specific to the First Nation Health Authority, so we'll make a note of that and we'll refer that one to the Health Authority right after this call. I understand the health authorities sent a questionnaire out to all communities asking them what their needs are. So hopefully whoever had the question received the questionnaire and identified that as well as part of their response to the health authority.
Thank you. Next question is, can the funding provided be used for security or enforcement on the reserve to maintain social distancing or any federal act that could apply on reserve?
Sorry, could you repeat that? I was reading text at the bottom of the screen at the same time.
Can the funding provided be used for security or enforcement on reserve to maintain social distancing or any federal act that could apply on reserve?
I haven't seen it listed as an eligible expense for anything, but nor have I seen it listed as something that couldn't be done. I think the best course of action for a First Nation, if they are looking at entering into an area where they're going to be retaining people to enforce different laws, would be to contact us. Have a specific conversation with us about it and the use of funds. And then we'll put that in the basket for follow-up as well and look to see what, if any, guidance we can provide to all First Nations on perhaps a somewhat more general basis on that.
Thank you. The next question again is in regard to allocation and just a general timeline on when things will be distributed.
The emergency management and social money that's already gone out should be released and in bank accounts the first week of April, I believe, if we've got the amendments back already. And I think our current situation is 3/4 of BC's First Nations have returned the amendments already. The second stream of funding, until we actually get the money in the region and are advised what the formula is, I wouldn't be able to say when a First Nation could expect it in its bank account. We will certainly look to turn it around rapidly, and we'll provide information at that time on when a First Nation could expect it to receive the money.
Thank you. Again, this is another question relating to off-reserve supports. So if off-reserve members do not attend friendship centers or other urban centers and are still connected to the First Nation community, can we support them like our reserve members, but will the funds be reimbursed if they choose to go ahead and do that in the meantime?
I think it would largely depend on what the support that's being provided is. We don't have clarity at this point in time on how we will access additional money in any of the program areas. And as I think everybody's aware, there is a bit of overlap in a number of different program areas when you look at things like personal protective equipment. FNHA might do it for health workers. We might do it for non-health workers. So there's a bit of a fuzzy line that needs to be respected. And we'll certainly need to try and clarify more information as soon as possible on support to off-reserve members.
Great, thank you. I'm going to skip the next question. It was kind of along the lines of the same one that you just answered. The next question is, you mentioned there is 15 million available for regional urban Indigenous people. This person who's asking the question is a not-for-profit organization, which is not a friendship center. We are here to help the Indigenous people living in the urban communities. How would we be able to access these funds? Who do we contact?
I'll take a look at my notes here. What I've got is it talks about friendship centers, Métis settlements. I think this question will need to get back to whoever posed the question with more specific information. Sorry, but unfortunately, I can't answer that on the spot.
Great, thank you. Next question is, there's a shortage of PPE nationwide. Is there a place First Nations can order more for frontline staff for ongoing operations such as the EOC, stores, gas stations, and small businesses?
Yeah, those requests, the fact that you need them should probably be communicated to us through our COVID email line. The funding, you know, it's an eligible expenditure under the emergency management money. But with like a lot of different things, I think it's not so much an issue of funding as it is an issue of actually being able to find a place where you can procure them. But if we have a sense of who needs what and the volume, it's something we can work with the province and the health authority on.
Which leads to the next question, which is, how are you working with the province and the federal government around PPE as far as when First Nations can expect to actually have those in community?
The bulk of the work on that front currently is being done by the First Nations Health Authority, so that's a question we'll have to refer to them. And I'm not aware that we've received a ton of requests related to PPE to our COVID line, but I stand to be corrected on that by probably anybody on the call here. And my own staff when I get back to the office, but it's certainly something I'll follow up on now that the question's been posed.
The next question is specifically for the First Nations Health Authority. Will they be providing food and supplies? So I'm going to say that this is something that they'll have to answer and that you can probably connect with them to do that. So in the interest of time, as we only have about 5 minutes left, I'm trying to skim through some of these questions. So my apologies. Next question. Can ISC top up band support funds so we can help our off-reserve members? We're a small, isolated First Nation with the majority of members off-reserve. Again, a lot of questions regarding off-reserve supports. So,
yeah, certainly the off-reserve support is certainly an area that needs additional information that we will follow up on. At present, unfortunately, I'm not aware of any additional money coming out for band support funding. But I think that also relates back to the earlier question about audit costs and some additional costs. There is some provision within the emergency management money for incremental costs related to things like overtime that would be eligible through that program. So it would be a partial help or assist to First Nations on the funding. But it's not going to be the end all be all, you know, to cover all additional costs for First Nations.
Thank you. Next question, is there any funding to provide for additional office space required for the delivery of essential services on reserve?
That one, I'm not sure if it's eligible under the emergency management funding or not. It's one we can follow up on. It would certainly be an incremental cost. So I think there's an argument that could be made that it should be eligible. But it's probably a time and resource issue as well on that.
Great, thank you. This was another question that was sent directly to our email. Let's see. How much aid money will go directly to members' pockets on reserve? How will nations be held accountable for public transparency and accountability regards funds that are earmarked for people? I ask this question because some disaster money has been given to a nation, but never to the people, and they can't get answers. That's a tough one.
That is a tough one. I'd be unable to answer how much money will go directly to individuals. It's just not possible to say because the situation's unique in every First Nation, and every First Nation's got a slightly different methodology that they're using to address the needs and issues and concerns of their members. Reporting mechanisms on the funding are still being hammered out on our side with respect to the First Nations. And we're trying to find the balance between not being overly onerous and what's required to be reported to ensure that, we don't come in on the back end and take away flexibility that we said we wanted to exist on the front end. So it's about all I can say on that one right now. There will be additional information forthcoming in the coming days with respect to reporting. So it's a bit of a stay tuned.
Leah, anything you'd like to answer to that question as far as monies that come in to support community members and getting the message out to the community as far as what the nation is doing with the additional funds to support?
I don't think we've spent any of the amendments to our funding agreement. The money that Bill has been talking about, what we have sent out to community to help has been funds that we regularly send out to our communities. And as far as transparency, I think people would just need to be looking to the audit and the audit meeting that I'm assuming every First Nation has with the community, which would be where I would answer those questions.
Great. Thank you very much. We're at the end of our time. We do need to wrap up exactly at about 45 minutes. As I mentioned, any questions that we didn't get a chance to answer, Indigenous Services Canada has committed to following up individually with those folks. So we do have your name and your contact information through pre-registration. So thank you so much for your time and viewing. Thank you so much to Bill and Chief Leah for joining us and sharing and answering questions that communities need answers to in this very uncertain time as they manage challenges every day as the situation continues to evolve. As well, I'd also like to mention the Facebook group that the First Nations Public Service Secretariat has. It's called the First Nations Administrators Network. That page is, the members of that page are community people who work in First Nation community administration, so other band managers, executive directors. Pose your questions there. There might be some communities that have can answer your question and have done similar things. So I encourage you to go there and do that. Other than that, that's it. We're going to wrap up. I raise my hands to both of you. Thank you very much. And we will put out another webinar next week, so stay tuned for that.
Thank you. Can I have one last word?
Oh, yes. Sorry.
Yeah, just a plug for your own website and the fact, I believe our daily messages to First Nations, are they up on your
Yes.
your website?
Yes.
Yeah, so I would encourage everybody to take a look at them. Our COVID email address is in part of the daily messages. There's contact information for every director in our regional office if you have questions specific to any of the individual program areas. I believe one of the recent messages also included our band social development worker line contact information. I know my own cell numbers on a number of the initial messages. And if you're having any issues, any questions that you're having troubles getting answers to, please get them into us so that we can get people working on them. As I said earlier, we're attempting for a 48-hour turnaround maximum on all responses. We'll get back to you as quickly as possible. Thank you, everybody.
Great. Thanks so much, Bill and Leah.
Thank you.
Thank you. On our website, if you go to www.fnps.ca, there is a red banner at the top that has all of the COVID-19 related information that Bill just shared. That's it. Stay healthy and safe out there. Bye-bye.
Thank you.
You too. Bye now.
Bye-bye.
Bye.